California is relatively regimented in defining who can practice what in the world of medical aesthetics. So at the very bottom of the totem pole are your medical assistants. Believe it or not, medical assistants are unlicensed professionals who can perform some services in medical aesthetics, but always, always, always under the direct supervision of a physician. That means that the doctor has to be in the building when the medical assistant is doing whatever it is that they're doing. And even if the doctor is in the building, there are many things that the medical assistant under no circumstances can do, such as injections or light-based therapies like lasers. The next step up from the totem pole would be your RNs. RNs or nurses can practice somewhat independently in that the doctor doesn't necessarily have to be in the building when they're doing whatever it is that they're doing. RNs are allowed to inject, they're allowed to do light-based therapies like lasers, as well as many other services, including things like radiofrequency and microneedling as well. The one key thing about the RN is that they're officially not allowed to make any decisions on their own, which means that they're not technically allowed to decide how much, for instance, Botox they're allowed to inject into you. They have to follow either a standardized protocol, or if they want to deviate from that protocol, they have to first get a written order from their physician, right? The next step up would be your mid-levels, also known as your nurse practitioners or your physician's assistants, NPs and PAs respectively. And they can practice near independently, and they also have the privilege of being licensed prescribers. So if your medical aesthetics clinic or practice offers Ozempic, your NP or your PA could prescribe that, whereas your RNs and your MAs could not. And just like your RNs, they can do pretty much everything in the world of medical aesthetics. And then at the very, very top of the totem pole, of course, are your physicians, and that includes your MDs, your DOs, and even your NDs, your naturopathic doctors. And they kind of have full gamut of everything. They can prescribe, they can do aesthetic surgeries if they're licensed to do, or trained to do so. And of course, your lasers, your injectables, and everything in between.